So let's talk about contextual fit. What is that? And I think you can kind of figure out like the word, context, like, what environment are you doing it in, and fit. So a contextual fit is that's the extent to which the characteristics of the settings, so the setting meaning like where are you implementing this program, are consistent with the program strategies, the procedures, the elements. What we would call a good fit is when the people who are implementing the program, your target population or your implementation audience, your stakeholders, and other people who support the program determine that it can be done, it should be done, it will be effective and sustainable, meaning it will keep going. So if there's a match kind of between what an organization or like a community wants with a program, then great, you've got good contextual fit. Sometimes you have mismatches, and this can negatively impact when you program outcomes and really negatively impact implementation. That's when whatever the program is doesn't solve a problem or fill a need. That perhaps the program activities aren't really described very well, accurately or detailed. So it can be hard to sort of know exactly how you are supposed to be implementing this program that program planners put together because it's not very clear. Potentially, there's sort of an evidence based issue where the proof of program effectiveness isn't available. So, ideally, you are looking for implementing programs that have some empirical evidence that, in a real world setting that is very similar to yours, that there is evidence that has been produced that shows this is effective. If you can't find like pretty much your same audience, like your same setting or same population, then look for something that has been implemented in similar ways to your setting. And that's better than like finding something like maybe you've got a, skin cancer prevention program that you found that is for teenagers and college students, and that you're trying to implement that for a group of farmers, right? Very different. They don't share a whole lot of characteristics. So that would be an example of poor contextual fit, if that makes sense. Occasionally, people who are delivering the program might not have the skills. So you have to have people with the necessary skills to implement it. So, really have a clear understanding of who you're looking to deliver your program and what kind of skills they need to have. So, and then provide training, right? Because they may know things in general, but you need to train them on exactly what they're going to need to implement this program. And remember, that happens right before you actually implement. Sometimes you'll have sort of this concept of cultural relevance, like where the program doesn't match the values of both the individual people who are implementing it, the organization that is implementing it, or even the target population that's benefiting from it. So you might need to do some adjustments or adaptations if that happens, because that doesn't have a good contextual fit. Let's see. Oh, let me go back one. The other issue, if organizational support is kind of out of whack, if you just don't have um, like an organization that is clear on its commitment and beliefs to the topic of the program or the way that it's being delivered, and that's not the individual people, it's the organizations that you may be working with. That can be an issue as well. So if you're for example, working with churches and they really don't share their beliefs are kind of a mismatch for what the program is, then that is poor fit. So let's talk a little bit about this idea of scaling and scaling up. You will hear this a lot. There's a big chunk of your chapter that dedicates itself to these challenges of scaling. So this means basically taking this program that was probably used, maybe on a smallish scale. But who knows? It could have been a bigger scale, but you are taking it for your population, and you are expanding that program to reach more people, right? So it's changing the size or the scale, like making it bigger. You're reaching out to more people. So the biggest challenge of scaling with public health programs is that you don't usually have the same conditions and resources that you had in the research setting, right? Like, that was done maybe in the published literature, you don't necessarily have those same resources. You may have multiple priorities. You may have, different, clearly, you would have different people on the team. So, what are some challenges of that? There are a couple of frameworks in your textbook goes through 2 different frameworks about scaling. So this is again, when you are taking a program from a research setting and implementing it into a real world setting that reaches more people, like more and more. So it could be, I'm just giving you an example, like um, you may be starting a program and you want to implement it across a school district. So, and your textbook talks about vertical and horizontal scaling. So, are you going to do it all at once? Which is, vertical scaling, like where, maybe you are, implementing that there will be like a fifth grade nutrition unit that is done throughout the entire school and you do it all at once. Or are you gonna do more of a horizontal, like maybe where you start in one school and then you kind of add, do then, 3 more schools and then you add 5 more schools, kind of, um, oh gosh, not consequent, one after another. Blanking on what that word is. So these 2 frameworks, and I'm not gonna go into them here, because there are very detailed, examples or very detailed steps on how to do that, and you would just pick one or the other of these if that is indeed what you were doing. Follow the steps there. It's pretty self-explanatory, and there's a lot of nice detail in your textbook along with really good examples. So these are all this just goes through all of those examples. If you want this kind of in a shorter form, it's here, the outline of it. But definitely, definitely, I recommend reading it in your textbook because there is just such a lot of good sort of examples of each piece of these. This is that vertical scale up and horizontal scale up that we talked about. Um, there's a lot of detail here. So if you're a person who likes to have things kind of outlined, I definitely would recommend reading both of these. So ExpandNet, that's the other one. So this starts sort of that idea of systems thinking, which we talked about previously, but it kind of bears thinking about here, like talking about the specific idea of systems thinking. So, this is about systems thinking about implementation, not necessarily about a health problem. So, those are 2 different things. So, this is system thinking applied to implementing a program. So, thinking, things don't occur in a bubble, right? So, your organizations are working together. How do they influence each other? How do your community leaders influence your local organizations and influence your target population when it comes to implementing. So, again, just realize that as we're looking through all of these pieces, these have to do with the actual putting the program into practice. This is the planning that you do to make that happen. So, that's systems thinking used in that way. Okay, so again, lots of detail here. Okay, I wanted to briefly talk about ethical challenges, and you likely have had some discussion of ethics. I know that you are reading about sort of ethical principles in your CITI training. That is part of that training that you're doing for this class, and you probably have talked about them in other classes. If you haven't, then here's kind of a quick one about program implementation. So, you know, ethical challenges, very important to think about these and kind of have these core ethical principles that guide what you do as decision making when it comes to implementation of programs. So just a couple of the 4 kind of main core ethical principles, and these are not just specific to public health, but really to most sort of science and the scientific community. So the first one is beneficence, and I think it's a good idea to sort of practice that one. Clearly I stumbled over it too. So this means maximize potential benefits and minimize potential harms. So the things that you're doing should bring good things to people. So that's beneficence. Non-maleficence, that's your moral obligation to do no harm. So think about, make sure that you're training people appropriately when they are going to implement your program. You certainly do not need untrained people teaching people how to do things, right? because that would violate this principle of non-maleficence. Respect for autonomy. This is a fascinating one when it comes to public health. So, this moral obligation to respect the rights of others to make their own voluntary decisions, right? So, this is a tough one for public health because we often do want people to behave in a healthier manner. So, there is kind of this tension, right, between making sure we're respecting someone's autonomy. But think about, do how do we respect someone's autonomy to not wear a seatbelt or smoke? So it is definitely a central ethical challenge for public health is sort of balancing that respect, but also this responsibility of our state, local, federal government to give some sort of health protection. So it's very much a balance, right? So whenever possible, we try to make sure that people are able to make informed decisions about their own health behavior. And we try to legislate as little as we can, but there is also this balance of trying to protect the public health, where sometimes we do have to step in with legislation. And we see there's oftentimes a lot of controversy when we do that in public health. Okay, so the concept of justice, just making sure that you are fairly distributing resources and any benefits, like health benefits, should be spread across people. Health risks should be spread across people. So, you're not going to collect data on one population on something that could improve their health and then not implement a program to improve their health. Like, don't use it for another population, say for example, and ignore the population that took the risk. So if you take the risk, you should have the benefits as well, and kind of balancing those things, just making sure that things are fair. So, okay, in terms of this idea of scaling up, so remember, this is taking a program and sort of broadening up who you're implementing it to. It's important to consult with your stakeholders when you are selecting a program for implementation, right? So you kind of have to figure out what are the interests of the community. Looking at some of these ethical issues, just making sure that we're balancing those things. What do they see as a need in the community? What is in the literature as a need, and having that conversation while you are selecting this program really helps ensure that this is ethically done. Contractual or collaborative relationships for program implementation, just making sure that you are just in sort of how you are hiring people, who is at the table when it comes to program implementation, like who is providing that. um, be careful when you are working with vulnerable populations. And these are immigrants, Native peoples, disadvantaged groups, minorities, young people, to make sure that you are sort of respecting their self-determination at the same time that you are offering something that could help with their health needs. So just making sure that we're really respectful of that idea that sometimes in vulnerable populations we need to make sure that there are choices that are being protected, their autonomy is being protected. Adapting programs, balancing that need with, what does the community need, what does this program specifically say needs to happen. Think about how you use publicly available data. So just make sure that you're keeping things confidential, maybe with information that you have. Um, Making sure you're being respectful of people's data and information about their health needs, health conditions, their behaviors, their attitudes. This idea of building capacity through commercialization, if you think about like scaling up and possibly like something at some point making a profit, you really have to sort of balance that with the interests of the community. Like, you don't want to make a situation where you are, for example, charging something that people of the community need, but they can't afford. So just being careful with that. It occasionally pops up in public health. Balancing that facilitating the program replication. How do you sort of balance what the public needs with the interests of the program developers? So make sure that how do I say this? That the program developers, that there's not a disconnect between what the population needs and what the program developers might want in terms of like collecting data, if that makes sense. Um, there needs to be sort of a give and take there. Okay, so you end up with an implementation plan. So this is something like who, what, and when of the program. So who is going to do what for your program? And remember, this is for your program implementation, outlining what's necessarily and necessary in terms of tasks and when will those activities occur. So let me see if there's a graphic of this here. So your implementation plan looks a lot like this, and this is a really nice example of this. This is on page 139 and 140 of your textbook. So you can take a look at that to sort of, refer to, I think is super helpful. So first task, sorry, who is going to do what? So look at your program plan and figure out, which, staff or employees have your needed skill sets. Who is going to be, somebody developing print material or distributing print material? Like, who is that? And how are you going to implement that among different partners? Because you could have several organizations that are involved in implementing a program. So who is going to do what and where are the skills? Who's your lead or your coordinating agency? Who's going to kind of do oversight and keep people on a timeline, say, for example? Look at what, so that first one was the who, what tasks are necessary. So think about what activities do you need? What are those preliminary steps that you need to make sure that you can implement them? What's the sequence of the activities? Which partner is going to be doing them? So that's a little bit, you got a little bit of that in the task one, who is responsible for what, but get specific with that. And that I think you can see pretty easily when you look at the task or at the implementation plan, that sample implementation plan, and you'll see where they identify who the responsible partner is and what they are doing. Task three is determine when the activities will occur. So remember, we talked about those timelines, what happens first, second, third, but also identifying literally what months will these happen, or weeks, or, months, weeks, and years that these will happen. And you need to have that timeline there. And then your last, oh, sorry, that was the when. And then your last step that you're doing is to create that written program plan that has all three of those pieces in it. Okay, that in a nutshell is program implementation.